This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadarzadeh, and we are brought to you by Butterfly Network.
Yes, we are. When it comes to successful ultrasound-guided procedures, precision is everything. That's why IQ3, Butterfly's handheld POCUS device, contains advanced features to support procedural success. With Butterfly's needle out of plane preset, you can visualize the needle tip within 1 millimeter after insertion. Butterfly's biplane imaging, the only multiplane imaging in a handheld ultrasound, lets you see both short and long axis views simultaneously in real time. And Needle Viz enhances your ability to track the needle in plane from entry point to the region of interest. Butterfly IQ3 also delivers image quality similar to cart-based POCUS systems at 1/10 the price. And unlike a cart, you can carry it with you anywhere in your pocket to conveniently use where you want, when you want. So whether you're inserting IVs, which I do a lot of, performing regional anesthesia, which I do a lot of, conducting cardiac assessments, which I do some of, gastric evaluations, some, and lung ultrasounds, or anything in between, the Butterfly IQ3 is the perfect probe for your practice. Visit store.butterflynetwork.com to claim a soft case with the purchase of IQ3. Use code BRIAN25 at checkout. Terms apply.
Do you know why Butterfly is going to love you?
Why is that?
Because you were doing regional blocks the other day.
I was.
In Northeast Indiana?
Northeast Indiana, yep.
And you just had that thing on standby. You were like, listen, this thing's not working.
Yeah, that's right.
And I'm not going to say the company or anything.
No, you're good.
But it's like, hey, this thing's not working. I'm going over to get the Butterfly.
We had a cart-based ultrasound system, which was fine. And I needed to quickly change from one image setting to another to do some scanning. And that system freaked out and shut off, so I just grabbed the Butterfly that I bring with me everywhere, and we used that for a little bit. Also, after you left, we scanned one of the participants' bellies because she's pregnant, so she wanted to see her baby. So we used actually the deep abdomen setting with the biplane, and we like did heart and everything for her. So
it's smooth.
That's
awesome.
Yeah.
Butterfly Network, thank you for sponsoring this podcast. Today we're talking about measles and the outbreak that's occurred, and the new Health and Human Secretary, Robert F. Kennedy Jr.
That's right. Yep.
Suggests that considering a measles vaccine would be something that they would consider.
Yes. as I think we should, yes.
So,
as we have since the,
1700s?
No.
Oh.
The measles vaccine. No. 1960-something, 70-something.
See, this is how the American public thinks. Yeah. Oh, since 1855.
No, vaccines are a 20th century thing. 1900s.
But people have been getting like measles for forever.
Yeah, a long time.
So let's break down what measles are exactly. And then I kind of want to go back and talk about where our generations are with this.
Yeah. We were talking a little bit about this earlier. So the measles is a virus. It's an RNA virus. We don't have to get into all the nitty-gritty specifics. It's basically like you get a cold, an upper respiratory infection, except it also has a bunch of other stuff with it. So you get the cough, you get the malaise, which is just not feeling good. You get the runny nose, but you also get this big rash, right? That's all over your body. That's why they call it the measles. It's a maculopapular rash, which just means it's kind of like some raised spots and some flat spots.
So chickenpox is bumps.
Yep, chickenpox is a papular rash, bumps. Yep.
This is
more
rash.
flat type rash. And so, most people who get the measles, even if you get them naturally, you've never had a vaccine, do fine. But a certain percentage of the population dies from it. Now, if you look back to, like you said, 1500s, 1600s, 1700s, and maybe even more sort of when we had modern medicine type stuff, 1800s, 1900s.
Yeah.
People had been exposed to the measles, and so just like the common cold or just like influenza even, if you got it, you're probably going to be fine. What's happened, though, since we've had vaccines is now if you get exposed, it's something that your body's never seen before if you haven't been vaccinated, right? Because it's not common, it's not running around, it's not everybody's getting it. So people now getting exposed to measles is a lot more dangerous than it would have been 150 years ago.
So, I grew up in the 80s.
Mm-hmm. As did I.
Got the measles vaccine.
Correct.
My parents that generation that's between 70 and 90
years old.
Yes. Where would they have fallen into that category? Because
That's a great question.
If I got it,
Yep. You got the vaccine.
I got the vaccine.
Correct.
They would not have gotten the vaccine as adults, right?
So I'm thinking, and I'm trying to remember exactly when the vaccine came out. I think it was like I think I have it on here somewhere. It was like the late 60s, maybe early 60s, late 50s, early 60s. We were just talking about this earlier, but so I just saw a big graph about who should be getting the measles vaccine and who should be worrying about it and who shouldn't. So there's actually
1961.
61 was when the vaccine came out. Yeah. So if you were prior to 1961, you probably got exposed to measles and you probably have natural immunity if you had it or you were exposed to it, right? So that generation's fine. There's this generation in the middle where the vaccine had kind of just started, and so it was starting to eradicate measles, but you probably also weren't exposed to it, but you might not have been too old. You might have been too old to actually get the vaccine. So there's this like 10-year period, and I can't remember the exact years, where they're actually recommending adults go back and get the measles vaccine. So, and the reason they're doing that is because we had essentially eradicated measles until there was a big push towards not vaccinating against measles, and now the measles are back. It's sort of like polio, right? We have completely eradicated polio, or essentially eradicated polio. So none of us, you and I, don't have a polio vaccine. But if polio made a comeback, we would have to go get one because we don't have any natural immunity to it.
So there's an outbreak.
Sure, Texas. Yep.
Kids should be vaccinated already, right? Or scheduled to get the vaccine, or no?
So you get it at a very, very young age, like baby age. So this is a set of children who have either not been vaccinated. It would have to be unvaccinated kids.
And you see this floating around on social media all the time now. People are talking about, first of all, I feel like there's a little bit of, I don't know if this is the right word, vaccine hesitation now.
Yeah, vaccine hesitancy. It's a term. Yeah.
Is it a term?
Oh, yeah. Vaccine hesitancy.
Because of the COVID-19 pandemic.
I think that's part of it. I think there's been a push towards vaccine hesitancy probably for the last 20 or 25 years. Just the way, and I'm a big generations guy, if anybody knows me, baby boomers, Gen X,
for sure,
millennials, Gen Z, alpha, beta. Anyway, so there was kind of this late Gen X, early millennial push of like, I want to be natural. We're not doing vaccines. So that's part of it. But yeah, certainly part of it is COVID. And you can debate the positives and negatives of the COVID vaccine. I do want to state I am pro-vaccine, right? So get your vaccines for your kids. But I do think that RFK does make some good points about the fact that we get 59 or 69 or some, like a ton of vaccines all at the same time. And so those things have never been studied all at the same time. I'm not saying not to get vaccinated. Get vaccinated, get your kids vaccinated, right? But I think that we should at least think about and maybe study what happens when you throw all these vaccines together and give them all at the same time. So that's my shameless plug there for at least a discussion about vaccines.
So I feel like everything is magnified right now.
Of course.
Like I feel like when we were kids, and I hate to say this because I hate to go back and be like, oh, well, there's grandpa. I don't want to do any of that.
We're of that age now, though.
Well, kind of. But it's almost like generationally, there's been a shift. It's like in the 80s, nothing was, and I don't know if it's social media that's
maybe
doing this, that's pushing this. Everybody has an agenda, right? Everybody wants their message out.
Yeah.
And so whether it's the CDC's pushing their agenda, who knows? I'm not saying anything bad about the CDC. I'm just saying, are they pushing the agenda of like, hey, get vaccinated, get vaccinated, get vaccinated? I'm just saying that it just seems like after COVID, we're getting a little bit of this,
There's a pushback for sure.
There's definitely feeling like there is pushback, and then there is a worry, right? Like H1N1. There's the the news variant. There's so every little thing we're just magnifying.
Part of it was that they pushed this COVID vaccine so much, and even to the point where they would take away some of your rights if you didn't get the COVID vaccine, right? The CMS, the Centers for Medicare and Medicaid Services, you had to have 100% compliance of all of your providers for them to pay you, or you had to have exemptions or whatever. But that's craziness, right? That's crazy. They don't even make you do that for the flu, right? So I think there's a big pushback on that because of how much it was sort of crammed down our throat. But
nobody was pushing that in the 80s. Nobody was cramming it down our throats in the 80s.
There was pushback against vaccines because they were required to enter school, right? So that's where the pushback came from, like late Gen Xers, early millennials saying like, I'm going to get my kids vaccinated because the school's making me, right? Anytime you force somebody to do something, there's going to be a certain percentage of the population that's going to push back. Right. So, but I also think, some of the vaccines are maybe not totally necessary, right? So now, and you and I were talking about this earlier, varicella, which causes chickenpox, right? You had chickenpox, didn't you? I had chickenpox.
When I was 4 or whatever.
Right. My cousin had chickenpox, and my mom was like, oh no, go over there, get it from him, right? So chickenpox, the fatality rate of chickenpox is infinitesimally small, right? Now, I guess you could make the argument that if you don't get chickenpox, that virus, it's a retrovirus. It stays dormant in your body and then can return as shingles. So shingles is painful. It's uncomfortable. It's a problem. And in rare cases, it can cause kind of major morbidity and mortality. So maybe there's an argument there. But, why are we vaccinating against chickenpox? The other argument I make is rotavirus, right? So that's a GI bug. Sure, in a third world country where you can't get fluids and go to a hospital and get an IV or whatever, it's going to kill a decent amount of people. But in the United States, rotavirus just causes that GI bug that everybody gets, right?
Yeah.
Well, now we don't have rotavirus anymore, and it's pushing. There's evolutionary push of norovirus. Now, norovirus is way worse. Look at this year.
Oh, my gosh.
We've had triple, like the worst week this year is like triple the amount of outbreaks as we've had in any previous year. So when you knock out a certain infection, virus, you're going to push others into its place. And so there is probably some, now, I get it for polio, measles, right? Measles can kill kids.
Right.
Mumps can kill kids. Even rubella can kill kids. Varicella, I didn't get the varicella vaccine. I had chickenpox. I felt crappy for 12 hours, and I have one like little pock mark right here. I don't know. I don't know if it's really worth it to vaccinate against that or rotavirus or things like that. I'm not saying not to. I'm just saying in the grand scheme of things, it's like, I'm not going to go drive my car because I might get in an accident, right? As opposed to, I'm not going to go drive my car with no wheels on it because I might get in an accident or a flat tire, right? So I don't know. Again, I'm not anti-vaccine. I'm pro-vaccine. I think you should take the vaccines. COVID's a whole nother story, but the basic pediatric vaccines. But are we maybe vaccinating against some things that aren't totally necessary? Yeah, probably.
Well, I will say this. It's pretty amazing the aftermath of COVID.
Oh yeah, yep.
It's almost going to be generations before that's forgotten, right?
Yep.
People were talking about the 1980 flu for generations.
1918.
What did I say? 1980? 1918.
It was the Hong Kong flu in the 80s. But
yeah, right. They've been talking about the 1918 flu for a long time until
probably 40 years.
Yeah,
so 2 generations.
But
maybe.
that's a long time. That's a lifetime.
But
right?
but every 100 years we get some sort of pandemic.
Plague,
right? Yeah,
whatever,
right. Exactly. So about every 100 years we get some sort of pandemic. So lucky for us, ours is probably over with. So our kids probably won't have another one. So it's great. We're good. Our grandkids maybe. The other thing I would point out is when you're talking about vaccines. So I know that the CDC and everybody pushes the flu vaccine. If you're not at risk and you don't have pure exposure to the flu, right? So like I'm not likely to get influenza if I'm walking around just
Sure.
normal. I'm not in school. I'm not over 65. All I do is go to work, the gym, and home. I'm not likely to get the flu. So again, if you want to say I don't want the flu vaccine because I'm not likely to get it, and even if I get the flu, I'm not likely to get super sick from it, I'm fine with that, right? You don't want to get it, fine. I, as a healthcare worker, probably have more exposure, but on top of that, I also am, again, kind of forced to, by facilities, get the flu. I do. Okay, so I've got one pet peeve here.
Yeah.
Not
Can't wait.
Not vaccine related. So I don't think this is going to be controversial, but so every healthcare worker has to have a negative TB, tuberculosis test to work at almost every facility. This is vestige of like the 70s, right? There are very few TB outbreaks, tuberculosis outbreaks.
I was going to say, how many? What is the
Very
percentage
rare.
now?
Oh, I don't know, but it's super rare. The only place where you really get tuberculosis are immigrants from third world countries and the homeless, right? So I really, and I'll put it on record, I think it's stupid that we have to get tuberculosis tests to work in hospitals, and I would like to start a worldwide or at least nationwide petition to get rid of that crap. And I don't think that's controversial.
Sweet. We're going to start it this week.
Let's do it. We're going to put some link down. At
We
the
will.
bottom here.
We love putting links in the description below.
So I guess obviously the reason this is coming up, it's politicized because of RFK, and RFK has said some dumb things. He's also said some things that make sense. And if you read his books, at least the books that I've read of his, he's not saying don't get the vaccine, right? What I take away from his books is you should research and consider vaccines, and we should consider all these vaccines together, right? And what's a little bit scary is that none of these companies that made the vaccines, any of them, including COVID, including the flu, none of them would do it without blanket immunity for whatever happened, right? That makes me a little bit nervous in general. Why would they give them blanket immunity? Because what if somebody's nefarious? And again, I'm not saying that happened, but what if somebody nefarious comes out and says, I'm going to put a little whatever in this vaccine. It doesn't matter. They can't, I have blanket immunity. There's nothing they can do. So again, you should get your childhood vaccines, but I don't think there's any problem in doing what RFK says, which is let's study the long-term effects of giving kids 69 vaccines by the time they're 6 years old. Why not study it? We might find that there's no problem with it. We might also find that, hey, maybe we could get rid of a couple, or maybe we could extend it out from, for the age of 6, we could extend it out to 12, and that's going to be better for kids overall.
I'm just, I go back to this thing when I was working for the university, and there was some upset parents.
Yeah. With the COVID vaccine. Yeah. Uh-huh.
Hey, did you hear about the kid who had an enlarged heart? Hey, did you hear about my son who had this? Did you hear about who didn't feel good? And it was, not that we're turning into a COVID conversation, but it was scary for those parents. It was scary for those kids. They didn't know what was going into the vaccine.
Right.
And so, but you were also wrong if you said, I didn't want to get a vaccine. Right. Remember, you were kind of outcast for a little bit because you chose not to get the vaccine. But now we're understanding, even a couple of years later,
there's side effects.
There's some side effects.
Just like anything else. There's side effects to Tylenol. There's side effects to ibuprofen. If you drink too much water, there's side effects, right? Nothing is without side effects. So, I respect people's autonomy and opinions. And if a 17, 18, 19, 20-year-old college kid said, I'm not likely to get that sick from COVID, and I don't want to take the risk of getting the vaccine, I don't think we should have forced him.
Yeah. Nope. Not at all.
So, was it smart for people over 65? Was it smart for people with 3 or more medical conditions? Was it smart for people who were being constantly exposed to COVID in a healthcare setting to get the COVID vaccine? Yeah, probably. But again, a 20-year-old kid, totally healthy otherwise, pretty low risk, right?
Surgeon General warning.
Yeah.
Is what they say. And if you want more of our conversation.
We got part 2. Yeah,
speaking of the conversation with the Surgeon General, former Surgeon General Dr. Jerome Adams was on our Medical Brief podcast, where you can kind of listen to on YouTube as well on your page.
Yep.
So we'll link it below so you can kind of tune into that. Great conversation about
Powered by
COVID.
Surgeon.
Powered by Surgeon, that's right. Great conversation about his past and kind of his his basically introductory tour into what it was like being a Surgeon General, living in his friend's basement or friend's garage in Washington, D.C., serving our country. And also in part 2 that's being released this Friday, you can hear more about the COVID-19 pandemic.
Yeah. Yep, absolutely. Yeah. And COVID is going to be a sort of a feature on that podcast. And we keep coming back to it on our podcast as well. Just because I think, we're 5 years out. I think a retrospective makes sense, and we're going to talk to a lot of experts and then on the Medical Brief powered by Surgeon. But on this podcast, I'm just going to, wane philosophical about kind of my experiences, as it comes up.
We love that.
Yeah. So yeah, just to kind of wrap it all up with measles. So I think it's, I don't know, maybe 50 or 60 kids now at this point. There has been one death. RFK came out and said, I recommend you vaccinate your kids against measles, right? And so, as much pushback as people want to give and whatever you think about RFK, I mean, I think that's the right thing to say right now, obviously. The other thing is, if you or your kids or whatever get measles, the likelihood of you having a major morbidity or mortality, major side effects is still very small. So it's just like they said with the flu and COVID, right? This is something Jerome Adams said, right? You're probably going to be fine.
Yep.
Right. And then just the other thing I was going to point out is make sure that you talk to your healthcare provider or you check the CDC website to figure out age-wise if you are, in that age range where you didn't have natural immunity from exposure to measles and you also didn't have a vaccine. So, those people actually, honestly, are probably at the most risk. And so I think it's important that those people go talk to their doctor, figure out if they need the measles vaccine.
Here's a pro tip from somebody who's not a doctor. Do your research.
There you go.
Do your research.
There you go.
From one doctor to another. For Dr. Brian Schmutzler, well, I'm not a doctor, so no, from one doctor to not a doctor. I play one on the radio.
You have a doctorate in podcasting.
Hey, not a PhD.
No, I didn't say a PhD. I said a doctorate.
Think of an acronym for a PhD for me next time.
Okay.
In podcast. It's just backwards.
Okay, I got it.
This has been Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We are brought to you by Butterfly Network, and we'll see you in the next one.